Hi, my name is John Elfring, and I will be delivering a presentation on the different leadership models for the transformational leadership model and the lens leadership art and science and public leadership and management model. Looking at the two different leadership models, the transformational leadership model and the lens leadership model, both have their strengths and are valuable in addressing challenges in healthcare. While transformational leadership focuses on inspiring individuals and teams, the Lean model provides a framework for managing complex systems and achieving measurable outcomes. By understanding these approaches, leaders can better navigate the diverse demands of the healthcare industry. We will take a closer look at both of them. Lin's leadership model, developed by Lawrence E. Lin Jr., is rooted in public administration and emphasizes governance, accountability, and structured management systems. This model is particularly well suited for environments requiring operational precision, regulatory compliance, and policy implementation. In healthcare, the Lin model ensures that administration processes and resource allocations align with organizational objectives, fostering transparency and efficiency. Leaders must have a balance between interpersonal, intuitive, and visionary skills and manage structured processes, accountability, and evidence-based decision making. Healthcare environments are dynamic and require leaders who can adapt to challenges while maintaining focus on organizational goals. Leaders who integrate both dimensions are better equipped to handle complex challenges like staffing shortages, patient safety concerns, and evolving healthcare technologies. That is why balance matters. Empathy and vision. Strong leaders articulate a vision for patient-centered care that inspires healthcare teams. Communication and relationship building. Promoting trust, collaboration with staff, patients, and families. Adaptability. This is the ability to respond to dynamic, unpredictable environment such as public health emergency or needs of individual patients. So it's core leadership qualities. This one's a human touch in healthcare leadership. Using clinical decision support systems and evidence-based guidelines to enhance safety and reduce errors. Data-driven decision making using healthcare analytics to impact resource allocation, patient outcomes, and cost. Using specific performance metrics, including patient satisfaction surveys, hospital readmissions rates, and employee productivity. Healthcare leaders must effectively integrate humanized empathy with the capacity to implement systematic, data-driven processes to realize organizational, and clinical objectives. So now moving on to the transformational leadership, works in the exact opposite way as the transactional leadership does. And that one is that the leaders engages and drives the followers to innovate and effect change that will help propel the organization's success into the future. It places priority on vision, empowering people, development in a personal and professional capacity, all of which can yield great engagement and performance. Transformational leaders lead by example, often challenging established practices, promoting innovation, and aligning team objectives with company goals. So this is driving innovation and collaboration for excellence in the patient care. So with innovation, the constant innovation is needed in the healthcare industry to improve patient outcomes, compile with emerging issues in the healthcare systems, such as new diseases, the technological advancements, and changing policies. Imaginative leaders foster creativity and empower teams to innovate and develop new solutions. Enhancing team performance, transformational leaders break down silos, often seen in healthcare, and unite multidisciplinary teams around a shared vision. Improving patient care. Transformational leaders inspire and energize staff, ensuring that caregivers are engaged and focused on high quality, patient-centered care. Now in the work culture, healthcare industry is often under stress itself, with heavy patient loads, scarcity of resources, and emotional demands. Transformational leadership contributes positivity to a good, pleasant workplace culture, which will increase the satisfaction of the staff and limit burnout. Now, adapting to the change, the field of healthcare is constantly changing. They lower organizational barriers to adapt to regulatory change, new technology, and the dynamic nature of patient needs, and encouragement of adaptability and forward thinking. Now, encouraging professional development by the individualized and consideration, transformational leaders mentor healthcare professionals, enable their skills, and provide career opportunities, which can improve job continuity and retention. Now, looking at the similarities between these two leadership models, let's focus on the goals. They both seek to provide alignment between what an organization needs and how individuals and teams work. They advocate achieving the best outcome, whether by inspiration or motivation. Now, at the application in healthcare, people also reaction more to other similar models, which also highlight the importance of adaptation and change with a leadership focus in healthcare settings. Now, the ethical leadership part of it, there is an ethical dimension to each model. Transformational leaders will have the standards, while the Lean model places accountability and transparency on the agenda. Now going to the differences between the two, with the approach to leadership, the transformational relies on interpersonal influence, vision, and motivation to inspire change and commitment. With the Lean model, it emphasizes system, structures, and governance for organizational management. Now, if we focus on the people versus the system, the transformational is most people-centric type of leadership, while the Lean model is a system-oriented, looking at policy, processes, and outcomes. Now, suitability for certain situations, transformational is best for fast-paced environment in need of both innovation and culture change, while Lean model is great in highly regulated environment where precision operations and accountability matter. Now, choosing which one I would pick, I would choose the transformational leadership model. Can benefit healthcare for a few reasons. Empowering staff, the transformational leadership prioritizes the growth and development of employees, which is critical in healthcare, where staff morale and professional satisfaction directly impact patient care quality. Now, adapting to rapid changes, the healthcare landscape is constantly evolving with new technologies, treatments, and policies emerging regularly. Such leaders foster creativity and adaptability, motivating teams to lead in face of change. Overall, if I can only choose one, the transformational leadership model is the most effective across all levels of the organization to improve human aspect of the healthcare business. Leadership, its focus on motivation, innovation, and personal growth aligns seamlessly with the goals of delivering high quality patient care and fostering a supportive, dynamic workplace. This concludes my presentation. Thank you for your time and attention. I hope you found it informative. Have a wonderful day.